Okay, so now how do we help someone with cognitive decline? This has been something that we have studied for over 10 years now because it's perhaps one of the scariest consequences of aging. If you ask most people, they'd say, yeah, okay, if I start to have a problem with my eyesight or hearing, that's not going to be too fun, but I don't want my brain to go. Um, what's the point of having a healthy body if your cognition has suffered? Some of this is a consequence of aging. Other times, again, this could be a very serious medical condition like Alzheimer's. So you want to take it seriously. You want to look at the diet because problems with cognition don't just happen, they happen for a reason. If you're not exercising, that could be a very serious problem when it has to do with cognitive decline and lack of mental stimulation. People go into retirement, they stop working, they're not using their brain enough, and their mental faculties start to decline. So you got to exercise the brain. All right, so what's the solution here? Well, we've done a number of clinical studies, and of course, we've looked through the literature, and there are a number of things you can do to support the health and function of the brain. One of those things, again, is turn on energy production in the cell, mobilize the stem cells, improve your diet. There are a number of supplements that are absolutely going to be of help here. Exercise. When you exercise, you're telling your body, hey, I'm alive, I want to stay young and healthy. You're turning on genes associated with youth. Exercise helps to maintain cognition. No getting around it. Stay mentally active. If you're retired, board games, reading books, having hobbies. I know when I retire in 100 years, I'm going to still be inventing because I want that mental stimulation. And sleep. If you're not getting at least 6 hours of sleep per night, you're headed for trouble. Lack of sleep is associated with Alzheimer's disease. Lack of sleep causes an increase in beta amyloid 2 protein, which is linked to Alzheimer's, increased risk. So if you're going for a very long period of time, months or years of lack of sleep, that's a huge concern. You have to resolve that problem. A couple things we can do here. X39 and X49. We've seen this now in our clinical studies. It improves cognition, no question about it. Carnosine. We have a fantastic study that we did with Dr. Tom Budzinski, Dr. Helen Budzinski, on using carnosine to reverse age-related cognitive decline. And of course, Shine and Dream for energy and for sleep. Now, I'd recommend that you take a beta-alanine supplement. 1 gram per day is enough. 500 milligrams is even okay. You find beta-alanine in red meat. So if you're not eating red meat, you may not be getting enough. And beta-alanine is a precursor to carnosine and to AHKCU, what X49 elevates. So I'd recommend beta-alanine. Creatine. This is interesting. We think of creatine as a muscle building supplement for bodybuilders. And that's true. It absolutely is. But creatine is a fuel for energy production. And in the human body, the brain and the heart use tremendous amounts of energy. So you can actually support the health of the brain with creatine. As we age, our brains will shrink. And one of the reasons is because of a lack of DHA, an essential fatty acid. You can get this from fish oil, from algae oil. And if you're not getting enough fish in your diet, like salmon, which would be rich in DHA, I would recommend that you supplement. there are nutrients out there that will improve cognition, like phosphatidylserine and cognizin. Some other nutrients as well. We won't get into those now since there's so many. But DHA, omega-3s are by far the best supplement for supporting cognition. But I wouldn't overlook beta-alanine, creatine, and some of these others. Olive oil, again, I'd recommend because it helps manage the inflammatory process. Make sure you're getting enough exercise and sleep. And by the way, you could expect, if you're doing all of those things or a portion of them, let's say you're doing X39, X49, and supplementing with beta-alanine. Our clinical studies show that you can get improvements in your memory and focus in as little as the very first week of use. Some people will take a little bit longer, about 3 weeks. But if you've been neglecting your cognition for many years, getting results the very first month is remarkable. So great news is that there's help.